what do you see as the key priorities in global dermatology over the next few years?
Being able to work with international health leaders, ministries of health, to ensure that dermatology is prioritized within Ministry of Health plans and strategic directives for achieving universal health coverage. The opportunities for dermatology is to influence those strategic plans, to work with the World Health Organization in the various departments that potentially have influence in achieving universal health coverage. It's really important that primary healthcare workers, community field workers are going to be able to manage common skin diseases in a simple, appropriate way for a primary healthcare setting, but also to recognize the skin manifestations of neglected tropical diseases and to be able to signpost those patients onto appropriate experts.
We've had 2 extremely successful World Congresses of Dermatology, where we've had more than 11 or 12,000 delegates, which means that the income for the World Congress of Dermatology and the ILDS have been substantial. This income, because the ILDS and the IFD are charities, goes into the projects which the IFD and the ILDS are associated with, training more dermatologists in underserviced areas and enabling people from these less advantaged areas to attend clinical meetings, educational symposiums such as the World Congress of Dermatology.
I think the priorities in global dermatology are going to be related to how we get better access for people around the world.
In the US, we are very fortunate that we have a lot of medications that we can access, even though there's still uneven access, of course, depending on the medication. But in other parts of the world where resources are much more scarce, much more limited, the access to medication and even to access to dermatology and dermatology care is very, very limited. At the moment, some of these drugs are very expensive to deliver to poor countries or poor patients.
Priorities probably relate to much of what's going on in war-torn countries, that we're creating problems that could have been avoided if people could have amicable solutions. But when you displace people, have people living in unsanitary conditions, not having access to proper hygiene, you wind up with a lot of things that we thought we had gotten rid of decades ago, which are coming back with a vengeance.
We have to improve access to care globally, and we have to find ways, and this is probably going to be using online platforms, push store and forward platforms for diagnostic and therapy of patients without them having to go in the doctor's office, with the benefit of being much more rapid using an online platform.
To ensure that we democratize knowledge, we are transformative, we are inclusive, and there's a platform for exchange of information, research, and knowledge.
What we're starting to see now is a shift in the resources towards lower middle income countries. This is something that the ILDS is very much at the forefront of.
Medicine is something that should be available to everyone. It should be something that should be, part of living, just as you expect clean water, a roof over your head. The ability to get the medications you need to treat you shouldn't be something only the wealthy can afford.
Is really to try to kind of make sure that the care reaches our patients, because that's what we do at the end of the day.
I think that is the role of ILDS, to try to see what we can do together with other global societies to enhance the access to dermatology and access to care and access to medications so that our patients can get proper dermatology care from around the world.